November 30th, 2024. It's just a normal, Sunday morning. My wife had gone out to grocery shop while I watched my two daughters. I just started noticing that my chest started getting tight. I remember getting a little lightheaded. I don't remember anything after that. Later on, I learned I went into full cardiac arrest.
I got involved in Alex's care because he had presented to the hospital with some symptoms of lightheadedness, and he had undergone a tremendous cardiac workup, none of which was revealing for the cause of these symptoms. So I was asked as an electrophysiologist to weigh in on as to whether he may have a rhythm abnormality that may explain some of those symptoms. I had ordered a monitor for him, and the next thing we know is he comes in with a first transmission being a cardiac arrest.
It was completely shocking because I was a 39-year-old athlete, been working out my whole life, played sports my whole life. I took care of my body, and for that to happen to me, I didn't see it happening to anyone else around me my age. It was kind of daunting. Do I have some sort of rare disease that's going to take my life? At that point, they had put me in an induced coma, and they started a procedure where they lowered my body temperature to preserve my brain function, my brain cells.
This device is called intravascular cooling. After a cardiac arrest, our goal is to lower the body temperature, and that helps to decrease the energy requirements to the brain.
I could not figure out why he came in with a cardiac arrest having had this extensive workup. Everything was completely normal. So that evening, I just went back and pulled up his rhythm strips just to examine them again. And I noticed that there was something very peculiar in his rhythm leading up to the cardiac arrest. That's why I subsequently referred him to one of my colleagues to perform cardiac catheterization with provocative testing.
Alex was diagnosed with Prince-Metal's angina, or coronary vasospasm. This is a problem where the blood vessels of the heart can clamp down or spasm just like a muscle spasm anywhere else in the body, but when that happens in the heart, it cuts off blood flow, and patients will have the symptoms or the signs of a heart attack. In Alex's case, he had been having discomfort in his chest, and then eventually he had a cardiac arrest due to an arrhythmia or an abnormal heart rhythm. And so when we identify coronary vasospasm using coronary function testing, we're able to put patients on the right medication. Based on this information with Alex, when we confirmed the diagnosis of Prince-Metal's angina, we then put him on a medication called verapamil, or a calcium channel blocker, which prevents this from happening.
After the doctors had done the research in the cath lab, realizing what I had, because I went through the cardiac arrest, they wanted to make sure that I had a backup system, and that's a implanted defibrillator, ICD. As soon as I went unconscious and into cardiac arrest, my 9-year-old, Analia, she got right on my cell phone and called 911. The dispatcher was able to guide her through CPR and start chest compressions before first responders arrived.
I feel grateful that I did that because it's like I helped him out.
She saved my life, and I'm just forever grateful, and I love her so much.